All right. So, good afternoon, Dr. Kiltz.
Ayalon, good morning, good afternoon,
Yeah.
and welcome.
I'm very happy to talk to you today. It's my pleasure talking to you about fertility issues and, the medical aspect. And also, we'll talk about like the Eastern and Western aspect of medicine and your center, and as well as the different services that you provide and the different issues that you go through and have in your several clinics. So just before we start, I just want to introduce you just a little bit more. So you're the founder and director of Central New York's first successful IVF center. And you're a diplomat of the American Board of Obstetrics and Gynecology, and a board certified in reproductive endocrinology and infertility. And you have a special interest, this is what I see, and special training in advanced reproductive technologies and laparoscopic and minimally invasive surgery, which is very, very interesting. You're a graduate from the University of Southern California, and you completed your medical school and university in California, in the University of California, Davis, I think it is. And you also completed your internal medicine in UCLA and USC in Los Angeles County's Women's Hospital for obstetrics and gynecology. And currently you have 4 practices in upstate New York, in Syracuse, Albany, Rochester, and Buffalo. I hope I'm correct on most of the information here.
It's a lot of the stuff that it's the stepping stones to get you where you're at, and it's kind of interesting because I was really trained as a Western specialist, and I'm still practice a tremendous amount of Western medicine, shots, pills, and surgeries, and it still continues to help so many. And I'm a kid from Los Angeles, and I live in upstate New York, and those practices in Albany, Syracuse, Rochester, Buffalo are sort of the brick and mortar, but we practice around the globe, and that's the beauty of this conversation. It's really sharing information to help people everywhere and integrating both of those Eastern and Western medical practices.
Definitely. That's actually why we're having this conversation, because it's not unusual, but it might be called a bit out of the ordinary that a medical doctor, he has a connection to Eastern and Western medicine. And we're going to talk a little bit more about it later regarding the different services that you have for different clients regarding Eastern medicine, and as well as hypnosis, which you are integrating and working on giving like a full service for people that have fertility issues and would like to go like the natural way, or as well help them with the medical. And I would like to know how you started in the field.
Well, I grew up in Los Angeles. My parents originally from Brooklyn, and they moved to Los Angeles and raised a family. And I was an artist. I did pottery and jewelry, and I didn't know what I wanted to do until I broke my leg when I was in junior college. And I met a young doctor that I was very interested in what he was doing. And it was my a family practice doctor that took care of a broken bone when I was 19. I found myself out of ability to do anything for 3 months with a broken leg. At the time, it was just they made me rest, and I found myself reading and looking for what was it that this guy did, and what did it take to get there, and that drew me into medicine. But also, I had a sister, Maria, who had diabetes and took a tremendous amount of care. And I saw all the debilitating things that she went through. But she also had a child, Justin, about the same time. And I found myself taking care of my sister through her pregnancy because she needed someone to help take care of her at home. And that's kind of how I got into medicine. And I wanted to be a family practice doc because I admired what this guy did. And so that's kind of how I broke into medicine.
Okay, so you started from the feeling that you have to create a change, or you were connected to this from the onstart. But how did you get to fertility, work with the women?
Well, the journey just to get into medicine, I had no idea I wanted to go into the field of infertility. Mm-hmm. And then after finishing undergrad, I went to UC Davis for my medical school. And it was there that I worked with a number of docs that were doing obstetrics and gynecology, and I really loved it. I loved the combination of the primary care and of the advanced care when it came to surgical treatment and medical treatment, and then the primary care aspect of it. And then when I finished my residency, I was actually in Denver. I went back to California, and I was practicing OBGYN at Kaiser in Roseville. And I met a doc, Kurt Klooster, was doing a ton of fertility, and I became his trainee. And so I helped them do a tremendous amount of fertility stuff, and I was very interested in it. I had no idea. I actually wanted to go into perinatology. And then I got a call from a doc that just started a fellowship in Los Angeles, kind of a cold call. And I was like, well, I must be attracting this into my life. I really love this, but I wasn't actively applying. And then someone called me, and voila, I was back to Los Angeles, where I wanted to be, where I grew up. And I was learning a new field that I found some real interest in that. So after a 2-year fellowship, 91 to 93, I wound up in Northern California, but I wasn't loving it at the time. It was kind of interesting. I was in a just IVF practice.
Okay.
And I wound up leaving that practice and coming to central New York, to Skaneateles, Syracuse, and starting my own practice because I really loved doing a little of everything. Obstetrics, gynecology, and I started the first successful IVF program in Central New York called CNY Fertility, and really from there, I've moved from doing everything to really focusing on fertility. I gave up obstetrics, gynecology, and I found a focus on fertility, and it's really become my passion. My hobby, my real love is to help in such a really difficult and challenging experience that anyone can have in life.
Yeah, definitely. That's also why I actually, once I studied hypnosis in London, then, my teachers there, my instructors, they said, well, you should find something that's, you should dedicate, you should specialize, you should find something. And I found Lindsay Eastburn, which is our mutual colleague. And she invented hypnosis for fertility. And she has this book, which I translated. We'll talk a bit about that a bit more. And what I found interesting is, I think the same thing as you. It's, for people that have different issues, fertility issues, for them to have somebody that really cares and helps them conceive, that for me, for you as well as a medical doctor, but me as a person that helps people, in the subconscious level or the hypnosis level or, in emotional level, for them to achieve their goal, it's a mysterious world, and to have that ability to help people, and then you see the result. I mean, what could be more fulfilling than that?
Absolutely. And so, the other question is really how did I get a little bit combining Eastern and Western?
Mm-hmm.
It's because as a standard American doctor, sad, a Western trained, Western focused, and the science was supposed to answer the question, and we're supposed to be able to carry out the procedures and help people on the path to success. But I was finding that too often that wasn't working.
Right.
And then through that, I found a frustration for myself where I began to seek the alternatives, as we've called them, for our own health and wellness. So my mental improvement, my physical improvement, and it really started off with someone, Heather from Rochester, calling me and saying, "Hey, I've got some patients I'm doing acupuncture on. You might find this helpful. Come and visit." That's when I started to experience it myself. And then at the same time, she connected me with Erin McCullough, who's our yoga specialist, and she at the time was practicing massage, okay?
Mm-hmm.
And so I with that, I began to practice all these things myself. I was going through some personal challenges. I began to seek out spirituality, meditation, yoga, mindfulness, and all these things. It was about 15 years ago where it really began to grow in my own personal understanding. And then I read a book called The Secret,
Okay.
by Rhonda Byrne. And then I watched the movie, and I began to really begin to touch on the concept of how the mind and the thinking in the mind actually touches every nook and cranny of our bodies and has a molecular reaction that I began to dig into a little bit more. And so it's really through experience, myself personally with physical problems and emotional problems, that I began to dig in and try to understand this whole process more. I read voraciously. Every time I read a book, there's 100 new books that I want to get into. And so really through The Secret and through understanding the mindfulness, I began on the journey of understanding how meditation and prayer and very ancient methods that really are the traditional medicines.
Correct.
Because that's what's been around forever.
Right.
And really alternative medicine is Western medicine.
You said it, doctor.
that we are, and so it was really difficult because many of my colleagues, I think we turn away from those things that we don't understand.
It's human nature, part of human nature. Yeah.
Right. And so I developed a website called Mind, Body, Smile with Chris Briel about 15 years ago, which was incorporating a combination of what we put in the mind, what we put in the mouth, and what we do with the body, that incorporates our joy and happiness of life, our ability to see things differently, or to think of things differently, then we see them differently. And these are the kind of the interesting components that I'm finding so valuable. And interesting enough, as I began to incorporate these things, I was having patients that I couldn't get pregnant with our Western methods say, you know what, I give up. I can't do this anymore. I've got to step back. And it drives us crazy emotionally. And then they were working with Aaron or Heather or Donald, all of our Eastern practitioners.
Mm-hmm.
And wow. And then my friend, Steve Wexler, who's a chiropractor, works a lot in India with Ayurvedic medicine.
Right.
And these women would go to the spiritual master and just be there with them. And then they would get pregnant.
Yeah, that's what we see a lot in hypnosis. I mean, it's mind-boggling.
Well, and I think that, and really, this incorporation of Eastern and Western, and is really this hypnosis and meditation and prayer and spiritual and methods that reduce stress in the body, bring about those natural things that are meant to happen. But it's something people are looking for the scientific study that proves it.
Well, we're working on that. I think Lindsay just came out with a book. There's a certain study that shows different issues. And I think that, I mean, probably in the future with you and working with hypnosis, then we could actually have a viable study, because there are studies that show that with mindfulness or, not only hypnosis, but if you integrate like a mindfulness program, the statistics go up to at least 55%, where women can conceive, where in the normal statistics show it's only 20%. They actually had a doctor in Israel back in the day, this was like around in the 90s, that did this study. But we still need to do some more studies regarding this.
Well, I always ask people if they believe in God. And most people I talk to, including scientists and physicians, acknowledge their belief in a higher power.
Right.
And there's no prospective randomized, double-blind, placebo-controlled study that proves that. So if I may, hypnosis and mindfulness is the belief. It's changing what's in the brain, the mind, through the thoughts. And it's, in my opinion, it's like saying to someone, I love you. Just those words make us feel better. So words, and it's in the Bible and many Bibles, and it's so often and everywhere, it's in the beginning was the Word. And through words, we actually find the wonder of what you're looking for. And so I practice much more, but we all get sidetracked because we're distracted. Because the human brain is a worrier. It's meant to worry more than it's meant to focus on the positive, if I may.
That's true. It is easier for the brain to do that. Yes.
Yes, and so what you're sharing is a tool to change the outcome and or change the path you're on so you achieve that outcome. Hypnosis is a beautiful tool that through reading or connecting with an expert like yourself, like Lindsay, and like so many others in this world. So a very, 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 very long time ago, the spoken word was converted to the written word.
That is true.
And through both the spoken word and the written word is where we learn new techniques but it's teaching us new ways of thinking. And I've always said that what goes in the mind is the master first. And if you can change that, but it is one of our hardest things to change.
In a way, it is, but if we take the mind as, like a beautiful garden, I'm sure you know about this metaphor. You have the mind as a garden, and we have a certain gate or a gateway, right? We have the conscious mind, the subconscious mind, and there's a gate to that garden. Now, normally we do not understand that we should keep guard, and whatever we hear from other people or feel from other people is planted as a seed in that garden. Now, a lot of clients that we have with hypnosis, they have like different issues with the environment where people say to them, they might say, oh, you're 35 or older, you can have a problem, you should, do different things, or, take the eggs, freeze them, or if they go for the first time to a doctor and the doctor's a little insensitive and he says, well, your eggs are old, and he didn't even check her, or some other pressure that they have. And with these words, get back to what you said with words, these words have power. They are planted in the subconscious mind. And most of our work as hypnotists is actually to dehypnotize people, to, take those seeds out and sow in new ones, give them the positive aspect, and open them up. And when you talked about prayer, prayer throughout history is very, very powerful because we're connected mentally, emotionally, physically, and we're in an aspect where we can receive. Whereas a lot of times women that go through the medical process, they have a problem of receiving, opening up, connected to the feminine side, because they go through all these procedures, and it's quite hard for them to connect to their natural way of things.
So for men and women in this process, and whatever individual or couple, however you're going through this journey, it's interesting. Obviously, we are all practicing the right words to say, but it is actually what each of us individually hears.
That is also true.
Which actually is less about what hits the eardrum. It's more about what we create in the mind. So the conversation that we're having has little to do with what I say or you say, but it's with what we are thinking individually and what everyone out there is thinking as they are listening to our words. Interpretation. And so the beauty of this universe we live in, and as you mentioned, the garden. So imagine that is actually all a garden. And so each, some people could look at a piece of junk and they can make the most amazing thing out of it, and other people will just walk away from it. It's our amazing capability of changing the story in here to change the landscape out there.
Exactly. I want to add on top of that, regarding women and men that are going through fertility issues. Doesn't matter which level they're in. We know as the fact that they're under a lot of stress. Here in Israel, all the top doctors in all the hospitals, they agree on one thing. They say that women and men that go through fertility issues are under terrible stress and strain. And because of that, once they go through medical fertility process, if they're not calm and connected to themselves, then statistically they have a lesser chance to conceive, or even to once they retrieve the eggs or put them back in, to become pregnant. Now, we know hypnosis is a very powerful tool in the aspect of the nervous system. So we have, in the nervous system, we have the sympathetic nervous system, which is fight or flight. And throughout, our modern age and time, we have to answer emails, we're on the phone, the boss, back and forth to the office, 1,000 different things. And some, family issues or what have you. We all know about the, modern day age. And so consequently, what happens to our nervous system is it just goes into fight or flight. And once that's, in the top, or we're connected to that, then we cannot, it shuts down everything else. You just, you have power in your hands and legs, but you're, you can sleep less, or you can't really sleep. You can't really eat. And also, fertility gets hit first, actually, because it's not needed. So with hypnosis, we get people back on track. We get them connected to the parasympathetic system. And consequently, once people go through the medical fertility, it increases their chances to conceive and become pregnant and have really nice time having birth, quite quickly.
So we've created these stories about what it is, but I think what you're saying, and it's 100% right on, is that we're really driven by the instinct first, and
reptilian brain, yes.
Which is as much as we want to overcome that, it is very, very difficult to do that. And really the set point in our brain is fight or flight versus rest and relax.
Right.
And so I believe through the thousands of years of our humanness, we have created these tools to overcome that fight or flight instinct. But like eating and whatever you're doing, you have to practice whatever you're doing on a regular basis.
Exactly.
Even when you think you don't need it, like, oh, I'm all done, I don't need it. But in fact, hypnosis, meditation, prayer, yoga are all valuable to practice every day.
Definitely.
Even after the success, because my bet is that hypnosis is not just for fertility, but for everything else in our lives.
It is, because this is like the fastest way for us. You mentioned yoga, meditation. There are different other types of medicine, but this, like yoga and meditation, you practice physically. Now, it changes your brain waves from beta waves to alpha waves to theta waves to delta waves. It slows us down. It connects us, to ourselves, to other people. And these days, that's what's missing. That's like the missing link. So that's our advancement, actually.
Well, so really important what you said, because you're changing the vibration and the energy level and the blood flow. So in the fight or flight mode, your blood flow to the core, to the GI and reproductive tracts is diminished. And epinephrine, cortisol are inflammatory producers. because you want the inflammatory cells to be sent out, platelets and white blood cells, and shut down the core. So the celiac trunk and the trunk that goes to the prostate, testes, ovaries, and uterus is shut down. Now, not completely, but tremendously impaired. And so it's the leading cause, in my opinion, of infertility is the shift in blood flow to the extremities. It actually even goes away from the brain.
Yeah.
So interesting, so everyone's thinking, well, I'm going to do all this exercise and I'm going to get blood flowing throughout my body, but in fact, it's going away from your kidneys, your GI tract, your reproductive tract, and it's going away from your brain.
Because there's still the fight or flight, and actually the process starts from the brain for fertility.
And so you can't even think or learn these new techniques in that fight or flight mode. And so a lot of this is, most of us are not fighting off lions and tigers and bears in a war. And so the practice is how to bring this into your daily routine when you wake up, as you're going off to work, as you're taking care of the chores, as you're going forward with anything you're doing in the day. You can take 5 minutes 5 times a day to bring this view in. And I don't know if Lindsay's book is on Audible. I do a tremendous, or yours, but I do a tremendous amount of Audible audiobooks, so that I can just listen to these stories. Right. So many of these books that you have and Lindsay has are filled with stories of success.
They are, definitely, yes.
And through stories of success, we then visualize ourselves as that success, and we feel better. It's like, I love you, or a hug, or a massage. And that's where therapy and hypnosis or journaling, but I always say, focus on what you want, exactly, not on what you don't want.
Definitely.
And too often our anger and our fear and our worry, we're blaming ourselves and others for the predicament, which is bringing our energy down in a negative way, epinephrine, cortisol up. And so there's a defeating direction to this. And so the focusing on, and again, these are all different tools in the box. Different tools are gonna feel more right for each person slightly differently. And so it's always begin with something, but if that something isn't working, go to something that maybe you don't believe in and you haven't given it a chance, like hypnosis. Hypnofertility is really a growing area that I'm glad to be sharing this globally. And we communicate with patients around the world. And our job is to share a story that they're going to send us a message and say, we're pregnant, that we're able to help them on a global basis. And maybe they won't need those shots, pills, or surgeries, or the advanced reproductive technologies, which are fantastic in and of themselves. But so many people that then fail those things, I always remind them, don't give up on having a success as natural as possible.
That's true. I mean, I believe there are always going to be a certain amount of people that do need, that's why the medical world with the fertility issues is terrific. Back in 30 years ago, people that couldn't have kids, they just couldn't have, And I'd like to add into what you were talking about. If we could give, it also goes for people that are doing medical fertility treatments and, the natural way. One of the things that what Lindsay wrote in her book, it's conceivable. One of the aspects, which is very powerful, and just because of that, I know people all over the world, therapists and medical doctors, that to promote the book, they hear back from clients, they just give them one thing. And that one thing is, a lot of people, that go through fertility issues, it's strenuous, it's tremendous pressure. It could be years on years. And a lot of women, and sometimes men, but less men, they go to these groups, right? And these groups for, fertility, like help, self-help. But what happens actually in these groups is that, people hear more and more bad stories, I don't want to go into it, but you know what I mean. It's, things that they don't need to hear. And that imprints on the subconscious and decreases their ability to become fertile and to have a baby. So that's one of the things that if people could do, they should go to experts. They should go to an expert fertility doctor. They should go do yoga. They should go do acupuncture, meditation, hypnosis. Go to the experts and don't just talk to different people, because they won't, even if they have a good, good meaning, sometimes they'll just hurt you rather than help you. Not in a bad way, but, it will to increase.
Well, there's risk. There's risk to breathing. There's risk to drinking and eating, and there's risk to everything you do in life. You can't take away the risk, and in some way we must risk the loss in order to gain the treasure we desire, and that's the hardest part. And it seems as if so many don't even begin on the journey because it's the worry of failure. Right. And so how can we, as Western trained physicians, practitioners, and when I say practitioners, I really mean there's Eastern and Western practitioners. It doesn't matter what your degree is. We're really all sharing ideas that we have to all begin to open up to, because I've had plenty of patients that just failed and then they had success on their own, and I gave up. But it's one of those things that we all need to go through our own experience.
True.
Rather than, and I believe today, because of the modality that we have in our global connections through technology, we're able to build the village and the family and learn new things. And I've learned how food, mind and mouth and food and keto is king. I've learned about anti-inflammation, low-dose naltrexone, and now CBD oils or cannabinoid oils. And it seems crazy, but there's so many herbal remedies. There's so many traditional ancient methods that help realign our energy to that which we desire.
That's correct. And I think this is one of the most beautiful things that, I have a chance to talk to you. Like back in the day, I couldn't talk to a doctor, it's, like unheard of, like a hypnotist to talk to a doctor or something like that, but the integration, from different fields all over the world, I think, there's not one thing to do. It's, correlation between different connections and different aspects.
I had a 44-year-old who did IVF with us. In 2 cycles, we canceled, couldn't get any eggs, all right? Mm-hmm. She goes off on the Eastern path and then adds keto along with that. And voila, gets pregnant, delivers a baby on her own. And so there are infinite stories, and obviously no one can tell you whether you're going to be that story or not. But we have to begin to imagine. I read a lot of Marcus Aurelius. I don't know if you've read much Marcus Aurelius, and it's just meditations, and really and through all of these, find something that feels right. But if it's not getting where you want to go, seek these ancient traditional methods that are not in our mainstream of Western therapy, which I personally am. If we're trying to prove something that's been around for thousands of years and helped thousands of people, I think sometimes we're going in the wrong direction, okay? Because you can pretty much prove anything you want or disprove anything you want. And there are going to be infinite number of articles, and some show benefit and some show no benefit. The question is, in my mind, is how harmful and what is the risk? If there's low risk, low harm, low cost, and there's some experience out there in this conversation or books written of how it helped, and the stories are told, it seems like a direction we should be looking at.
That's true. I have a question, Dr.
Please.
There's a certain issue in fertility, right? Which is a lot of times it's, they would call it, right, endometriosis, right? And it's a big issue because it's kind of unexplained. But if you look statistically worldwide, I forget, you might have the statistics better than me, but there are a couple 100 million women that, they say between, around between 8 to 15% or 8 to 12%, depends which study you look at. Or let's say just an even 10% of women have endometriosis. And it's a big issue, which I don't think the medical world has addressed it, at least enough, in the amount. Could you maybe elaborate on that? Because I had some questions from people regarding that.
Well, the cause of all disease, including infertility, is inflammation.
Mm-hmm.
Okay? So we are alive and created due to inflammation. We're kept alive due to inflammation, and we will die because of inflammation. And so the inflammatory conditions, pretty much you just go down the list: diabetes, hypertension, cancer, irritable bowel, colitis, bladder, kidney problems, liver problems, and fertility problems, including DNA fragmentation of sperm and eggs, of pelvic inflammation, which shows up as endometriosis. So we're really naming these things based on what it looks like or the organ it affects, but in fact, they're all caused by 5 simple things.
Okay.
Glucose, due to a high plant-based diet. We all eat a high plant-based diet, and plant-based diets are just high in glucose naturally. The plant antigens, so plants have antigens, glycoproteins, or proteins that stimulate an inflammatory reaction in us: asthma, hives, anaphylactic reactions due to seeds and nuts and other plants and fish. Go down the list. Then there's phytochemicals, so the chemicals that come with the food that we eat. Marijuana, THC is a chemical, arsenic, cyanide, glycoalkaloids, and I could go down the list. That there are a lot of chemicals that are plant-made, nature-made, not man-made. That the pesticides are not the largest issue. They're probably narrow compared to the plant problems. And then the plants come with bacteria and yeast, fiber, and glucose. Now, when you consume them, they ferment in the gut.
Mm-hmm.
So fermentation creates alcohol, aldehydes, heat, and gas. So that heat and all that bacteria and yeast that we're feeding creates more inflammation in the gut, and the gut inflammation, and especially the large intestines, which heats up and secretes all these inflammatory products right next to the ovaries, tubes, and uterus, and the peritoneal surfaces that have to send all these immune cells to protect itself, and it damages at the same time.
So it builds up.
it builds up. And remember, I was just looking at an article. The average age of first pregnancy is in the later 20s and 30s, not in the teens and early 20s anymore. So we're postponing childbearing. So rather than being a brand new car, we're a 5, 10, 20, 30-year-old car. And they have much more damage due to the environment that we put in,
the consumption of bad
from the outside. My opinion is that healthy diet we're supposedly eating, and then the unhealthy thoughts we're focusing on, is the cause of that very high immunologic reactions going on in our body that affects from top to toe, stem to stern. Every part of our body is affected by the environment that gets into our body. And so this inflammation, we call it endometriosis, or we call it unexplained. And I have found that laparoscopic, hysteroscopic approaches are still very valuable. And quite often they remove endometriosis, and then women conceive. Interesting, simply through mindfulness, meditation, hypnosis, we are actually reducing the immunologic fight that's going on in our bodies and our bowels. And if we look at keto and paleo diets, keto is king, which is a high fat, low to no carbs. I think the combination of mind and mouth suppresses the inflammation in the gut, in the bowels, in the bucket, which is where we find endometriosis. And my belief is that the endometriosis that we see is only a part of the tip of the iceberg. There's a tremendous amount of stuff happening on a microscopic level that we cannot see with our standard methods. So I've always say, if you've got a problem, it's an immunologic inflammatory problem 100%. And approaching these diseases like endometriosis, which most people talk about today as like, well, you can't have endometriosis because you don't have pain or endometriomas in the ovary. But I disagree completely. The leading unexplained cause of infertility is inflammation, and the most visible inflammatory cause is endometriosis, in my opinion.
It's interesting, because a lot of times I've seen some sort of statistics that we're going to talk about a really sensitive issue like hysterectomies. A lot of women that go through these procedures are actually, they say that they have endometriosis, and like 50% of them, of the hysterectomies, are because of that type of issue. And regarding that, I've seen studies in Japan, right? Because endometriosis looks like a cancer, right? Which it's not. And in Japan, when I think it was Fukushima blew up there, right? They had a couple nuclear reactors blew up, and there was a certain doctor there that he conducted studies. He gave for, I think, 30 days, he gave IVs of 50,000 units or milligrams of vitamin C, right, a day. And over a short period of time, they showed that they had the cancer, but, they came out totally from this aspect. Do you guys, as a doctor, do you recommend like a high dosage of vitamin C?
Well, we do discuss a tremendous amount of anti-inflammatory treatments, and vitamin C, vitamin Bs, vitamin D, and really, if you look at so many, again, there's so much gut inflammation that actually depletes the body of those important minerals and vitamins. And so, that's really a big focus. And where we know about vitamin C infusions. We do a lot of intralipid infusions, which is a high fat infusion. I highly recommend to stay away from grains and grass. And in my opinion, fruits and vegetables are also more harmful than we understand. And so it's a hard one as a vegan or vegetarian, but it can be done by focusing on more natural fats, coconut fat and hemp seed oil. Tremendous great oil that has a lot of omega-3s, but it has a lot of vitamins and minerals in it. And so I think that our variety, we have too much variety in our lives. Variety is deadly. And then we have too much spice and colors and all these things. And we're looking for the one answer. And that's the hard part, that, it doesn't exist in the sense for each and every one of us, but maybe the single answer is inflammation. And so all these modalities we're talking about are just different ways of healing inflammation.
That's it. That's a good thing. I can connect to that on like a hypnotic level, because when you say we have a big variety, right, which means we're not connected to nature, we're not connected to the seasons, we're not eating, from our own area or the own foods of the certain season. So we have all these things and, different spices, different chemicals back and forth. And so we're not connected to our natural habitat, and we're on the same level, not connected emotionally, physically, spiritually, mentally. So I think you're right about it when you said that there's no one answer, but actually the one answer is to get to that equilibrium.
And so the equilibrium, we need to always, because if you lean to the right or lean to the left or forward or back, you're going to fall. But it's in a sense, we're working to be on the razor's edge and balance as best we can. And it's a challenging process. There are bad things that happen to all people in life, but in fact, maybe none of it is bad. It's just part of the journey of life. And I don't even know what our natural habitat is supposed to be, because we've invented so many ways of growing food and shelter and living in places that I don't know how we have managed to do that. But here we are today with these amazing resources that if what you're experiencing isn't where and what you want to be happening, you need to seek out others that have gone through the experience to share with you ways of making it. Interesting enough, some people like it and some people don't. We're all praising or destroying something in our lives, and how can we fit all those together as each a piece of the puzzle that creates this amazing picture called our lives.
That's interesting that you say. I want to ask you, just before, I'm sure we're going to have more talks and discussions, and I'd be very grateful to have that in the near future. I would like to ask you, Dr. Kiltz, what is your vision you have 4 clinics, right? You're integrating Eastern and Western medicine. You're doing a really good job regarding. Yeah. What is your vision for the next 10 years? You're a young guy,
I'm only 62. I'm very young, and I feel fantastic. And I think my vision is to really practice in a better way to take care of that which is in front of me today. And sharing the stories like this can help so many on this really challenging journey without ever having to come and see me personally. I want to continue to share the story that you can take control of what you put in here and what you put in here to manifest better what you have here. And also, I think how each of us can better love ourselves so that we can practice loving each other in a better way. And I think that's it. And I think I still focus on how to continue to make this process uh, accessible and affordable. Building a family is the foundation of life. And I see in America that is way too costly for most to go through this fertility journey. And IVF is inaccessible, difficult to access for most because of locale or just finances and lack of coverage for it. So my dream is really daily to continue to help more and more find the access and affordability and the quality that it happens either naturally or we can help you find the way to happen with assistance.
Now, let me just add, Dr. Kiltz, I mean, when you go into your website, I mean, everything is up front. You can see success rates, you can see the affordability, you can see the different plans. You have people that get back to you on information quite fast. And I mean, you also have, what's beautiful about it is that you have the Eastern and Western. So people have increased success rate. So that doesn't mean that they have to come back and forth again and again,
And it's really difficult to look at success rates and understand what they mean, as we all practice medicine differently. We accept different people into the process. We allow people to do more and more cycles. And so the one thing I've learned in life is persistence is the path to your dream. And don't give up on that. But it is really hard. We all get down. We all get frustrated. We all get angry. I know the other day I was a little short with some staff and some patients, and I knew that it was just I needed to take a few moments to slow it down. And so we really need to do that. And what you're sharing, I'm really grateful, and I look forward to more conversations of how to integrate Eastern and Western methods, because really in a modern way, I mean, we fly airplanes and drive cars, and we're utilizing the mastery of science into new modalities, and yet we still need to come down to our very ancient and basic nature of what goes on within this gift called our lives.
Definitely, and I'd like to add just one last thing. I think this could be like our maybe our connection in the near future or in the future. I'm sure that I mean you have Lindsay's book in English. If you could show it up, and it's called "It's Conceivable," right? And it's the second edition, and I've just translated "It's Conceivable" to "מקלט לתת עבודה בשירות הפוריות, היפנוזה לפוריות." So basically, it should be coming up this week, hopefully, on Amazon. So if you have any clients that are Jewish, or they speak Hebrew, and they would like to have like enhancement in while working with you. I mean, we work as you do, through the web, and we provide service. So I'm sure that could be a great thing for you as well.
Well, we're grateful for that connection, and so we do a lot of work in New York,
Right.
and my grandparents came from Italy to New York, and there's so many people around this world traveling, but language is we need to work better how to communicate and bring our languages and our cultures together, and so we also have a book called The Fertile Secret.
Right.
The Fertile Secret, which we're hoping that you're going to help us translate that.
I definitely want to. I know that you're updating it, and once you finish updating it, that's I'd be very happy to translate it, because it talks exactly about the Eastern and Western medicine combined. I would definitely love to do that.
Well, we're looking forward to that translation, and we know it's going to happen. So again, gratitude. So
Yeah. So thank you very much, Dr. Kiltz. It was my pleasure, and we'll speak soon. And keep up the good work, Doctor.
oh, Ayalon, to you too, please. We're grateful. Keep up the good work, and we look forward to your clients and working with you globally. God bless.
Thank you. God bless.
All right.
Okay.
Bye.
Take care. All right. So good afternoon, Dr. Kiltz.
Ayalon, good morning. Good afternoon.
Yeah.
And welcome.
I'm very happy to talk to you today. It's my pleasure.